if your immune system begins attacking your body, there's usually a reason for that. The immune system becomes confused because it's not designed to attack our own proteins in our own body.
I'd like to start off by asking you about your approach to medicine versus the traditional medicine approach. Could you talk about that?
Yes, yes. So I started right out of the gate in 1998, thinking very holistically about people's health issues. And I was in the first group of doctors in the country to go through functional medicine training. There was a applying functional medicine and clinical practice certification that I did in 1998. And so
And
right from the get-go, I was thinking as the body as one system. And then, as I progressed in my career, I started thinking about the impacts of how we think and how that affects the body, and even the impact of childhood trauma and kind of unresolved energetic complexes left over from traumatic experiences in the body, and how that can affect not only our energetic anatomy, but eventually our physical health. And so, yeah, so my holistic thinking kind of continues to go to higher levels of inclusivity. And now I'm even thinking about, our seamless integration with the environment and with the unified field that we're part of, and so is all other aspects of creation. So really, to think broadly is the only way to approach complex illness.
and that's why I'm so happy you're here, because I think that first, because you're already one of the first functional medicines which has a view that is more holistic, include more overall the human being, not just the physical part, but everything that is part of the person. So thank you so much for being here. And since you're talking about about the thinking, I would like to know more, because I see you talk about toxicity. You also talk about the nutrition and mold and many other aspects that you measure, and hormones, but also you mention about the importance of your thoughts and or emotions in our physical well-being. If you could explain a little bit more, and it might be something new for many people who have autoimmune disease, and the audience who is here.
Yes. Okay, I'll start off with the toxins. Fascinating story is that one of my very first patients, when I got out of residency and began practicing in San Francisco in 1998, came to me with multiple sclerosis. So autoimmune disease, where the immune system is attacking the myelin sheath of the neurons. And so I did a very thorough history, and it turned out she did her PhD work in Alaska and did a lot of hiking in the gold mining territory. And that at that time, the primary way of kind of some of the chemicals used in the gold mining industry could expose people to a very large level of mercury. And she said she would eat fish out of the streams in Alaska. And so I measured her mercury level. I started right out of practice with the kind of thinking that if your immune system begins attacking your body, there's usually a reason for that. The immune system becomes confused because it's not designed to attack our own proteins in our own body. And so usually there's a triggering factor, and then there are perpetuating factors. So the triggering factor, I was thinking in her case, was possibly mercury. So mercury can tag your proteins, rendering them a little bit different looking to the immune system, and that can provoke an autoimmune reaction sometimes. And sure enough, in her case, I did a provoke urine excretion test for mercury, and it came back astronomically elevated.
Oh.
And And we began a multi-year journey of getting the mercury out of her system. But from the very first treatment, which was actually the diagnostic test that was also therapeutic, her MS went away and she never had another MS exacerbation for, I've been practicing 25 years. So it's been 25 years now. And like I said, it took us about 4 years to get all of the mercury out of her system. But in that case, that was the triggering factor. And then, like I said, there's usually perpetuating factors. And one of the perpetuating factors that I see in a lot of autoimmune situations are deficiencies of adrenal cortical hormones. So the adrenal glands sit on top of your kidneys in your kind of mid back, and they are two glands in one. There's an inner part of your adrenal glands that make adrenaline, and then nothing usually happens with that part of the adrenal gland, but there's an outer part called the adrenal cortex that makes a variety of steroid hormones for you, like cortisol, DHEA, pregnenolone, some of your testosterone, some estrogen in women, aldosterone. But these steroid hormones are immunomodulatory. And the primary steroid, cortisol, helps you cope with stress. So sometimes if a person's been under stress for prolonged periods of time, the adrenal glands will work overtime to cope with that stress, work overtime, and eventually will begin to get depleted, kind of will eventually poop out, and the levels of those hormones can go down. And then you lose the adequate checks and balances that those hormones usually serve, with your immune system. So like I said, they are kind of anti-inflammatory, immunomodulatory, and when the levels of the adrenal cortical hormones can fall, you can be more prone to autoimmune disease. So it usually takes a triggering factor and then these kind of perpetuating factors. And you were asking about
the thoughts, because
yeah.
No, it's okay, because and we know now the cortisol can be like if you're too much stressed, you're having too much cortisol in your system, or you're producing, correct me if I'm wrong because I'm not a medical doctor, but it's affecting our health. But then what is happening with our mind and emotions that is triggering all that?
Yeah. Okay. I'm going to talk about that one second, but I do want to say that yes, you can have ill effects from too much cortisol, but you can also have problems from too little. And so what I think often is the case with autoimmune disease is that people have moved from having too much to now having a depleted adrenal gland and having too little levels of cortisol and DHEA and things like that. So that's what I most often see. But your thoughts can create a tremendous amount of stress for you. So you oftentimes what we think to be true about reality, about our interactions with other people, about
life
in the world, about life, are related to kind of early programming that we've experienced through our interaction with our caregivers and our family members, and even traumas that we've experienced. And then stress. So these experiences kind of program the way we see the world and how we project onto situations and interactions, and how we interpret people's responses to us. So then that can affect the emotions that we experience resulting from our thoughts and our perceptions. So if someone is experiencing certain emotions, it can cause tremendous stress in the body. So if on a chronic basis, someone is experiencing kind of anger or frustration or sadness or anxiety or grief, those have a certain kind of vibratory rate that can actually have deleterious effects on our health.
Yeah, and I think that is so important for people to become more aware of that. And I think still people think about the stress, but they don't think about how the emotions can affect. So I assume that when we go into the opposite range of emotions of joy, of
Mhm.
compassion, of love, that would also, can you talk about if it would also affect our physicality?
Very much so. Yeah, I definitely. I mean, the higher vibrational emotions of peace and love and joy have a beneficial effect on our physiology, almost by virtue of transmuting lower vibrations. And so the more that we can think thoughts that generate these kind of positive emotions, particularly chronically, the better it is for our health. There's no doubt about that.
Yeah, and I think it's a very important topic for people who have autoimmune disease because most of the
Yeah,
time, especially when someone gets diagnosed, it can be quite scary, a lot of fear, and sometimes create anxiety. Sometimes even in the long term, people get depressed because it can be involving their mobility, and sometimes they go into this spiral that is so important to become aware of it so they can reverse that in their way of thinking also. And I'm
yeah,
very, yeah, I like when you mentioned the projection that we have. It's almost like sometimes we can have like my glasses, instead of being clear, has a type of filter.
exactly.
Yeah.
Yes, absolutely. It just colors how we see the world. And I believe that one of the ways that you can kind of clean the lenses so that you have a closer approximation to the truth of what's going on, as opposed to your perceptions based on your projections, is to do some deep meditative work. And so I think that for people with any type of illness, really, but definitely autoimmune type illness, where your immune system is kind of attacking your own body, it's really important to spend time in meditation every day and do some energetic maintenance, almost like cleaning your kitchen at the end of making a meal. Like, you really, at the end of every
Maybe
morning,
like even
beginning of every
brushing your teeth, right?
yeah,
That you
it should be
definitely
just
going to
part
do.
of your daily activities, because I do it every morning when I wake up, and then if I've had a particularly hard day, I try to do it at the end of the day also. But it's just where you ground yourself and really tune into any areas of the body where you may be holding tension, maybe become accustomed or learn about energetic anatomy, like your chakra system, your auric field, and so that you can kind of like do a scan and actually kind of see your awareness in different parts of your energetic system, and get clues as to whether you're holding something there. Because if you are, you can kind of sit with it for a while and really ask to learn what it's there to teach you. And then once you've done that, you can usually ground it off into a grounding field that you've established. And that's, may sound esoteric to people, but I really feel that our energetic system is as vital to our physical health as our physical organs are. And, with time, they are going to be valued as such, because, we've got, let's say, our chakras, they are almost like energetic transformers, and they can transform the more subtle energy of our kind of coming from the environment into the chemical language of our endocrine system and the electromagnetic and sonic language of our nervous system. So very much anything that we have kind of stored in our energetic anatomy, like our chakra system, can have profound effects on our physical health.
Yeah, and I think
Yeah.
many times also I see that people who have autoimmune disease are quite sensitive people, and many times without understanding much this, their hypersensitivity to feel what is happening in the body, and they can get affected. But because they do not know, or I teach embodiment, which is like to meditate through sensing and feeling the inner space of the body. So many times it's having something that grounds the person helps a lot to also be in a better condition to deal with whatever happened in the environment, even the most subtle energies.
Absolutely true. And I do agree that very oftentimes people with autoimmune diseases are more sensitive and maybe perhaps more empathic. Yes. And then, really, when I think of going back to what I was saying earlier about triggering factors and perpetuating factors, so probably by far and away the most common triggering factor in autoimmune disease from a physical level is our infections in the body. So whether it be a reactivated viral infection or a chronic bacterial infection that's maybe transmitted even by a tick bite, let's say, one of the kind of tick-borne diseases like Lyme disease, or Bartonella or Ehrlichia or Anaplasma, Mycoplasma, chlamydia, or even imbalances in the microflora of the intestinal tract, or bacteria that's more focal, like growing in the site of an extracted root canal, like an extracted wisdom tooth, or at the site of a previous root canal or something like that. So sometimes there's an infection somewhere in the body, be it focal or more systemic, that can be the triggering factor. And then that takes us back to the more kind of energetic underpinnings, because I think that if you're not fully embodied, and you maybe had situations happen to you in your earlier life that made it difficult to stay embodied, you're going to actually be more prone to invasion from microorganisms.
The house is empty.
Exactly. So if no one is home, so someone else is going to take residence there. So like, even if you have a real physical trigger like an infection and you're going to be treating it on a physical level, you still need to do the embodiment work that sounds like you do, where you are learning how to really inhabit your physical body.
Yeah, and that brings presence, brings also awareness, what you're talking before, to know, even to be curious, even to be curious. I always like to say, be curious about what the body is saying, be curious about what the body is showing, because the body is many times what I call an instrument of communication. And
that's right.
Yeah. So, but sometimes people are in a hurry and they are not listening to what the body is now screaming, and then, okay, now I stop. The body is screaming. I gotta listen.
Exactly. Yeah. Oh, it's so true. And oftentimes the messaging is very symbolic.
Yeah. So talk about symbolic. I would like to go a little bit into and mention about your book. So your book, for the audience who doesn't know, is called Your Pristine Blueprint: The Missing Key to Longevity, Reversing Disease, and Radically Transforming Your Life. And it might also be new for people and for the audience, but I would like to have a little bit of explanation. What is our blueprint? And then how it affects our health, which is, I think we are already talking, but if you can talk about the blueprint, I think it would be great for us to know more.
Absolutely. Yes. So I started thinking about our blueprint when I was studying quantum physics and really kind of new thinking in physics that states that we are all part of a unified field of energy and information. We're all derived from this field, and we're inseparable from it and from everything else that's derived from it. And if that is true, how is it that we arise as this unique expression of the field when we are such complex multicellular organisms? We've got 37 trillion cells, each with millions of chemical reactions happening every second in a coordinated manner. And that's an incredible level of complexity.
Yeah, when we think about human beings, it's kind of like a mind-blowing, in fact.
It is. It is.
Wow,
And
this is incredible.
yeah, and the kind of mind-blowing nature of our physiology has always fascinated me, and that's how I kind of got into all of this. So what I've really come to feel after studying embryology and cell biology and all of this is that we are derived from like a particular field of information, and we, at the moment of our conception, a blueprint forms that guides our embryological development and growth as a fetus, and then also contains the operating instructions for this complex physiology. And really the unified field that we are a part of is just energy and information. And the other cool thing I learned when I was studying physics is that it's not static. Nothing is static.
Everything is moving.
Everything in our physical reality is not only moving, but it's forming and annihilating trillions of times per second.
Oh, wow.
And so how is it, and if we're really just made up of kind of intersecting vibratory waves of information, and how is it that we are forming as this complex 37 trillion cell, organism, and then annihilating and then forming again? It's because
appearing and disappearing.
Right. We have this blueprint that's kind of guiding these waveforms into our physical form. And what I think is that with time of going through life, sometimes our information field gets contaminated with misinformation that comes in the form of energetic signatures of pathogens, energetic signatures of toxins, even of retained emotions and unmetabolized emotions left over in the body after traumatic experiences. And this, as we accumulate misinformation as we're going through life, it can begin to disrupt this seamless translation of our blueprint into our physical form as we are forming and annihilating. And that's what results in entropy, breakdown, aging, and disease. And so you were talking earlier about, the beneficial effects of kind of high vibrational emotions. Well, I really do believe the higher vibrational energy can transmute some of the misinformation.
Makes sense.
And so, really,
or neutralize at least.
Yeah.
And neutralize the effects, perhaps.
Yeah. So if we realize that this whole process, let's say, of molecular mimicry that is kind of at the root of autoimmunity, where you have a pathogen and your body starts mounting an immune reaction to a pathogen, and then the antibodies, let's say, cross-react with our own proteins, well, then that can persist after the pathogen is even gone. So it's almost like the information that pathogen contained is still affecting the orchestration of the immune response even after it's gone. And so what I've learned through the years of working with patients is that I need to work on a physical level with them. Yes, treating infections. Yes, balancing hormones, possibly working on the kind of helping them to get in touch with stored emotion and all of that, but also work on the level of removing energetic signatures, which is a little bit easier said than done.
I was going to ask about.
Yeah.
If you can talk a little bit about that. What is
And this is going to sound very esoteric to a lot of people, but I believe that this is kind of the medicine of the future, really. I think eventually, we're going to have infoceuticals and, be working really on the level of information, because that's what everything boils down to. And molecules are really proxy for just information, which is really the vibratory signature of that thing.
Yeah, and I like very much when you say blueprint, because if you get, I use the word disconnected sometimes from our own self. So this disconnection from our blueprint will have an effect of something is out of alignment, So that's makes sense when you say, so the molecule is, they are getting information and suddenly you're getting the wrong information because you're out of alignment then with your blueprint. I don't know, for me, it makes such a sense.
Yes. Yeah. And I think we can really learn when we're starting to move out of alignment. And it can really affect just all of the decisions that we make. Is this from the food that we're eating to the products that we're using to, the kind of environments we're going into, to the people we're choosing to interact with, we'll be able to come to the place where we can really tell, like, is this enhancing my interaction with my blueprint, or is it creating misinformation and disrupting that interaction? And now has misinformation accumulated, and what can I do to either remove or transmute that?
And that is my question. Because I sort of interrupted when saying about the energetic part. How would, like, in terms of autoimmune, because I was saying about the disconnection, is for me, it's like, could be also this, there is an effect on the energetic parts of the body, even the energetic organ, the organ that is in energetic form before it's in the physical form. So how would one align more with even energetically, or with the blueprint?
Yeah, well, I learned a lot about this by doing a procedure for a number of years now called OCMOS. And OCMOS is an energetic balancing treatment where I use an instrument called the Lecker antenna, and it's a non-electronic kind of yes/no instrument, and I can ask the human body that I'm sitting in front of, first I measure their energetic field to see if it's balanced or not. And if it is not, I'm asking the person and the higher intelligence of the body of the individual, what pieces of misinformation are throwing your energetic field off. And so I might get information that there's a bacterial resonance or a toxin, or even geopathic stress or electromagnetic stress or something like that. And then I use a kit in this OCMOS procedure where I can find something that's in resonance with this piece of misinformation. So meaning like that these two signals are matching. And then I can put this in kind of like a circuit and allow that to pull the misinformation out of their system, almost like toward a magnet. And then I can unwind the compensation their body has had to do energetically around that misinformation, and then ask again. And then, then pull that out and then unwind and ask again. So it's a very laborious, but beautiful treatment that I've done for years. And so I realized that this is how I learned a lot about these kind of energetic signatures. For example, like I would have someone who they were still sick, even though let's say they were diagnosed with Lyme disease and co-infections, and they were still sick and symptomatic, even though the test results show that they didn't have the infections anymore. And then lo and behold, I would find that they still really were retaining the energetic signatures of those infections. And then I would pull those out and kind of unwind the compensation, and then they would feel better. And sometimes it would be so obvious to both of us that, like, oh my gosh, like a noisy party just left the room because like there was so much energetic interference in their system. It was creating like a level of chaos that was kind of right below their conscious perception, but they became conscious of its absence. Then all of a sudden that like a sense of deep peace descended on them. And sometimes the chaotic information would be like throughout their entire system. And sometimes it would be very much localized to a particular organ or, a part of their body. And so I started seeing kind of these miracles happening over numbers of years of working with people with this. And I'm a very busy practitioner, and so I don't have time to do this kind of one-on-one work with very many people. So I started really looking in maybe about 5, 6, 7 years ago into how else can we address this? How else can we do this on, where it'd be more widely accessible to larger numbers of people? And so I started working with some resonance biofeedback type devices, and we have a really cool setup in my center, Jizen, where we are working with kind of hooking people up to electrodes and detecting information signatures in their system that are off, maybe aberrant because they're associated with toxins or some sort of pathology or a pathogen or something like that. And then we can send back corrective frequencies through different means. So we can send it back through electrodes or through plasma bulbs or through scalar technology or through ultrasound probes. And so we kind of do all of those things. And we have a great practitioner here at the clinic that's kind of really, really immersed herself in this work. And that's been absolutely game-changing for a lot of people with chronic illness, not just autoimmunity, but cancer or, multi-infectious disease and chronic fatigue syndrome and that sort of thing.
And also, I'm sure degenerative disease also that can
be
really
neurodegenerative
difficult to treat and to get help. Oh, wonderful, wonderful. Thank you. And I have here all the information of your pages in this below the video where people can connect and get to know more. And if they're interested also to get to the information and perhaps have a treatment also, because that seems like a very deep transformation. I'm very happy. And I think we are coming to the end of our session. It's really wonderful. But I know you are quite busy also, and I really appreciate your time and your wisdom here. And just before we finish, I always like to ask for one word or one tip for the optimization of our health for people who are suffering with an autoimmune disease. What would you say, or one tip to do something, or a word?
Boy, yeah. I mean, I just will reiterate that I think meditation is a very core kind of practice that usually will help whatever ails you. And then remember that with most autoimmune diseases, there's a triggering factor and then some perpetuating factors. And the triggering factor most often would be infections, toxins, and the infections could be systemic or focal, and they could be, in the body at large or in the gut or in the jaw or in the sinus. And then the perpetuating factors most often are hormonal imbalances and sometimes nutrient deficiencies, and other times more on the level of kind of psychospiritual.